We are the 3,000 members of the Ontario Nurses Association who belong to the Community Care Access Centres, and we're on strike for fair pay.
1, 2, 3, 4. We won't take it anymore. 5, 6, 7, 8. ONA will negotiate.
Fellow ONA members, I'm Linda Haslam-Stroud, and I'm very proud to be your provincial president of 60,000 members of the Ontario Nurses Association. As you know, or maybe don't know, the Ministry of Labour representative has called ONA and requested we meet with representatives from your employer today. I am planning on leaving here in about 15 minutes. Dan Anderson, your chief negotiator, Marie Kelly, Bev Mathers, and myself will be going over to meet with the Ministry of Labour. Now, when I say going over, guess what, folks? We were meeting here until last night, about 8 o'clock, and guess what? I don't think your employer wanted to come through and walk through all of our great health professionals in the CCAC. So guess what? That's right, shame on them. They won't even face you as the healthcare professionals providing quality care in our communities all across Ontario. So, just to let you know that we are going in there, and as you've been identifying, we have been willing to negotiate. We have been willing to negotiate from day one. How is it that 57,000 registered nurses and allied health professionals are able to get 1.4% wage increase after 2 out of the last 3 years of wage freezes, and your employers, the 9 employers, are unwilling to step up to the plate? Shame on them! 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 How is it that CEO salary in Central CCAC just 2 years ago was $277,000, and now it's $304,000? How is that? Chop from the top! 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 So how is it, oh, my favorite CEO, how is it that Southwest CCAC, Sandra Coleman, goes a few years back from $100,000 plus to $288,000? Yeah, shame on her! 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 How is it that you, registered nurses and allied health professionals in our CCACs, each and every day are saving taxpayers' money by having our patients in their homes, getting care where they want it, and we are out here being frozen out and being forced, they think, to take wage freezes? How is it that they're patting their pockets and they're trying to freeze us out? Well, I'll tell you, folks, it might be freezing here. It might be freezing here, but they are not going to freeze our wages. They are not going to freeze our wages. There's no reason, as I said, that 57,000 RNs and allied health professionals can be provided a minimum of 1.4% in a contract, and these 9 employers are trying to freeze us out. Stay strong, and I guarantee you we will do everything everything we can to fight for a collective agreement that values the work that each and every day you provide to our patients across Ontario. 1.4! 1.4! 1.4! 1.4! 1.4! 1.4!
1.4! Leading up to the strike, I was hopeful that maybe the CCACs would take an effect that we've been on a price freeze, wage freeze for the last 2 years. No, we had no contract for the last year, so I was hopeful. But unfortunately, when they told us, I thought, no, I can't. Even though I didn't want to go on strike, I can't afford to go on strike, I had to, right? And I have to support, we have to be together.
So originally I understood that the organization, the Ministry of Labour and ONA had agreed to meet here today at 400 University. Unfortunately, at the very last minute, the location was changed. Linda is actually advocating on our behalf right now, and we're hoping that today will end our strike. That's what we're hoping for.
Walking a little bit, keep yourselves warm.
1, 2, 3, 4! We will take it anymore! 5, 6, 7, 8! 1, 2, 3, 4!
We won't take it anymore!
5, 6, 7, 8!
ONA can negotiate!
Up from the top! And healthcare workers across this province have been freezing their butts off for 12 days for fairness! And up there, you better listen and get a deal! So thank you for your strength! I send you all the solidarity in the world and see you on the picket lines if they don't get a deal today! But we want to negotiate!
We want to negotiate! We want to negotiate! We want to negotiate! We want to negotiate! We want to negotiate! We want to negotiate! We want to negotiate!
So what we want the managers to come back to the tables. We've been picketing, we've been asking to come back to the table and meet with us with regards to what our requests are. And unfortunately, they've done everything from lock us out of the building to call the police. They made us get rid of our burning barrel. It's just craziness, and they're refusing to meet with us. They've even locked the door to the building so we can't up and knock at the door to let us in to discuss what our issues are.
We just want to get back to work. We want to reach a deal and get back to work and care for our patients.